I guess we can start. Good evening. Thank you for joining us on an incredibly, my son says, disrespectful, cold New Hampshire night. My name is Feliz Rom. I'm a political science faculty here at PSU and a member of Sidore Lecture Series Committee. You have no idea how happy and proud I am to host this particular lecture. A little before we go into that, and a little bit about Saul O. Sidore Lecture Series. It is named for humanitarian and New Hampshire businessman Saul O. Sidore. The Sidore Lecture Series was established in 1979 by PSU and the Sidore Memorial Foundation. The series brings a variety of speakers to campus to address critical issues and events in politics, society, and culture, topics that reflect Sidore's interest. Every time I read about Saul O. Sidore's history, I get goosebumps. So let me, for those of you who haven't heard of him, let me introduce you to him a little bit. A first-generation American, Saul O. Sidore was born in New York City in 1907. After losing his job during the Great Depression, Sidore and his future wife, May Bloom, joined her parents in founding the juvenile knitting mills. The family's enterprises moved to New Hampshire in 1940, and by 1955, Sidore was president of Brookshire Mills and Pandora Industrials of Manchester. Sidore's business practices reflected his ethical principles and his interest in providing security for his employees. He pioneered a profit-sharing plan, instituted a pension plan, founded a scholarship loan fund to help his employees send their children to college. And he was the first employer in New Hampshire to hire an industrial psychologist and institute insured hospitalization benefits for employees. Think about it, 1950s. Saul O. Sidore, who encouraged employees of all levels to participate in business decisions, created a joint committee of executives and employees to discuss their issues and held quarterly meetings with all employees to discuss the company and its future. Saul O. Sidore was the owner of the Manchester Free Press, a member of the New Hampshire Advisory Committee to the United States Commission on Civil Rights, and was a driving force and in support of the ideals of humanity and brotherhood throughout New Hampshire. So I am so proud to be a member of Sidore Lecture Series, and I just wanted to share who he was with you. Our theme this spring is titled Recovery and Renewal. God, don't we need it desperately. We are focusing on how, especially New Hampshire, recovers and renews in the wake of social disruptions and widespread trauma. Our lectures this spring will explore past experiences and current efforts to understand how we heal as individuals and communities. And our speaker, Fiona McEnany. I can talk about Fiona probably for hours, and I will not do that because it's not about me, and I want her to start speaking too. But first thing first, and I cannot believe, not that long ago, Fiona was a student at PSU and graduated in 2018. And I know that we have several students joining us tonight, and I am hoping someday soon we will host some of you here too. So in 2018, Fiona graduated from PSU, 2 undergrad degrees, BS in biology and BA in political science. What an awesome combination. So then Fiona went ahead and received her Master's of Public Health degree from the Dartmouth Institute for Health Policy and Clinical Practice. And currently she's working on her doctorate in microbiology and immunology at Dartmouth College. While she was at PSU, actually, she was one of the 60 students selected nationally to present scientific research to Congress in Washington, D.C. in 2018. In 2021, she was named the New Hampshire Union Leaders 40 Under 40. Also in 2021, she was Stay Workplace New Hampshire's 2021 Young Person of the Year Award. She received that one. Fiona is a New Leaders Council New Hampshire alumni co-chaired and has interned at the Centers for Disease Control and Prevention in Global Health Policy. I better stop here as I can go on and on. Her talk will focus on creating equitable communities through collaborative innovation. Without further ado, Fiona McEnany, mic is yours.
Thank you, Felice, for that very kind introduction. And thank you, PSU. It's great to be back, and I wish we were at a point where it was possible to be there in person. Today, I'll be talking about creating equitable communities through collaboration. So to do this, I'll focus on the idea of intersections and nexuses. First, I'll talk about my career evolution from PSU to now, using the specific example of equity-focused biomedical science and how finding all of our individual passion intersections and how teamwork is necessary for sustainably equitable community building. So first, a little bit about who I am. I grew up in Franconia, New Hampshire, and witnessed a lot of health equity issues in a rural area early on. I graduated from PSU in 2018 with dual degrees in biology and political science with a minor in peace and social justice studies. I started as a biology major and by my junior year realized how passionate I am about political science and advocacy and added the second major and minor. I had many opportunities to explore these interests and their intersections while at PSU. Here are a couple pictures of me presenting posters with work from PSU and PSU related research. Next, I decided to pursue a Master of Public Health because I knew that while I was interested in laboratory-based research, I wanted to do it with an equity and advocacy lens. I wanted to add that extra layer of understanding about how science fit into the world and how it can be most impactful for increasing equity for intentionally excluded and under-resourced communities. This is my nexus, the intersection of my passions, and I knew that there would be synergy if I was able to work at this intersection. I graduated with my MPH 2 years ago, and now I'm a doctoral student studying neonatal herpes. Neonatal herpes is a devastating viral infection affecting babies perinatally. There are 14,000 cases reported annually, but this is likely an underestimate, and death occurs in 30% of cases where the virus spreads through the body. And as reported recently, fatality is more common in Black infants. I'm also continuing with my advocacy passions. I've received leadership training from the New Leaders Council, a program for progressives under 40, and Running Start, a political training program for young women. I have also done policy work for the New Hampshire Public Health Association. These are experiences that have been pivotal in the development of my advocacy and policy skills, and for helping me find a voice in science and expand my work into the national and New Hampshire political communities. The point of sharing all this is the convergence of my interests. Given my interests in biology, health, and advocacy, health equity and health's role in a just society have always been a huge focus and is part of why I decided to pursue a public health degree before my PhD. The next few slides will be examples of how health equity is at the heart of many common conditions. So here we see COVID-19 case, hospitalization, and death rates. We can see here that there's a distinct trend with race, with those identifying as Black, Hispanic, or American Indian or Alaska Native having higher rates for all. Here we see high blood pressure, stroke, and diabetes. Same as before, we can see a distinct trend again, with the category of African American having higher death rates at all ages for all three. Next, we see pregnancy-related deaths. Again, the trend is very clear. We know that many of these deaths could be prevented and that layers of prejudice play a central role in why these women are dying. Further, we know that Black babies are more than twice as likely to die compared to white babies. Here, we see cancer rate by race. Unsurprisingly, the non-Hispanic Black population had the highest age-adjusted death rates for each of the 5 cancers shown. So all of what we just saw is driven by a combination of these factors. Our systems, health, educational, carceral, housing, and more, were designed to uphold an equitable status quo. These systems make it hard for intentionally excluded communities to access healthy food in food deserts, obtain high-paying jobs, and more, making well-being a difficult goal. Compounding this, lack of access to healthcare and prejudice and racism within the healthcare system lead to no or inadequate care. It's important to point out that this is often associated with race, but not always. There are layers of intersecting inequity and prejudice that must be acknowledged outside of race. Inequity is baked into how we function as a society, and it's intentional. Another facet of health inequity is that biomedical research is often focused on conditions that impact otherwise societally privileged people at comparatively high rates. For example, breast cancer, cystic fibrosis, and Alzheimer's are all highly funded. This is because these conditions have advocates with privilege and leverage. Emerging infectious diseases, many of which cause pandemics that, as we've seen with COVID, impact intentionally excluded and under-resourced communities to a higher degree, and they receive less funding, and in the past few years have had funding substantially cut, especially in relation to emerging infectious diseases. So currently, the standard public health approach is based on prevention and response. This includes epidemiology, intervention, which is often behavioral or economic assessment, and so on. But this stool only has 2 legs and is a little bit wobbly because it's missing a key component of a robust prevention, treatment, and intervention scheme. However, when we add back the missing leg of biomedical research and make sure that equity is a central component required for the stool's stability, we see a much more solid, robust situation. And this brings me to why biomedical research is so important as a part of a public health response, and why public health epidemiology should be a key input into determining laboratory research foci. So this is typically how biomedical research is set up. You look at current evidence, you come up with an idea that could push the field forward, you apply for funding using this evidence as support that your idea is well-grounded, and then hopefully you have a discovery that may eventually make its way to the clinic. Where my passions converge is using epidemiological data to understand where health inequity is happening, what conditions disproportionately affect intentionally excluded and under-resourced communities, and what are overlooked in terms of funding and research and development. I like to think about what are we funding? What are we prioritizing, and how are we applying equity to the conception of research ideas and questions? My hope is that we can use this contextualization of conditions to frame research through an equity lens and identify high-need areas where new therapeutics could play a role in increasing equity. However, discovery only goes so far, and innovation that doesn't make it to the communities that need it most is a big lost opportunity and equity concern. Next, it's important that scientists take an interest and, when needed, active role in advocating for their discoveries at the policy and implementation levels. Of course, this doesn't negate the need for the other pillars of public health. Prevention is very important, as are societal shifts, but treatment goes a long way for helping people who are sick now and for softening the blow of future illness and helping build a system where current inequity and regression towards the status quo are a little less powerful and likely. So, as we've seen, our systems are failing at multiple levels, and they're all interconnected. I've shared one example of a systemic shortcoming and a proposal to help remedy it, but the reality is that there are many instances where our systems are unfair and where they could benefit from a new structure that isn't so siloed. This isn't theoretical. Talking about this doesn't help beyond increasing awareness. It shouldn't stop at being a thought exercise. There's a big difference between academic conversation and a paradigm shift that helps people. We have to commit to action. We've just spent time thinking about how the intersections of fields can have a synergistic impact on increasing equity and creating just communities. Now we need to think about how we operationalize our unique skills and passions and the even more unique ways in which they intersect, dismantle our current systems and rebuild stronger, more equitable, and more just communities, both within our own passions and their intersections and with everybody else, figuring out how they all fit together. Our greatest impact will be at the nexuses of our passion and our creativity in finding those intersections. And it needs to be sustainable. This way of thinking needs to be integrated into our educations, our career decisions, and our everyday choices. And implied in that is that it is all of our responsibility, especially those of us who are societally privileged. And it's important to note that you can be privileged in some ways and not others. It's not a binary. To find intersections in our lives and careers and take action to simultaneously dismantle our systems that aren't working, start to recover from COVID-19, and to build a more equitable, just society. So with that, please grab a piece of paper and a pen and start to brainstorm. I think this should be one way. I think it should be a conversation. And I would like to ask you to take a little bit of time to think about the following questions. Might take time and introspection, so please feel free to take screenshots, pictures, whatever. So what are your passions? How do they intersect? Spend a little bit of time here. Then next, how can you apply this intersection now to help restructure our systems? It's not enough to just have the thought, it needs to be operationalized. And then looking forward, how can you work towards applying it in 5, 10, and 15 years? What does this look long-term? How does it intersect with other people's ideas? And then most importantly, how can these interactions be configured to improve the lives of those around you and ultimately to build equitable and just communities right now? So in order to do that, this can be at any scale. We need to remodel everything from our federal government and international relations to local playgrounds. So however your passions fit into the whole puzzle is the right place to put your efforts. And in order to do that, we need to break the mold. So we're used to our current systems. They've been in place for a long time. And pursuing something interdisciplinary that's designed to increase equity will be different for now, especially because most interdisciplinary efforts are somewhat manufactured and are not born out of people's individual creativity and passions. But it's a necessary step for all of us. So thank you again for having me, and I would love to answer some questions now.
Thank you so much, Fiona, for this insight. And I would like to ask our participants, or I'm actually going to ask Nick too. So you can raise your hand, or through Q&A, you can also ask your questions in a written format, and Fiona can see it, I can see it, and So both options are available to our audience, don't they? Nick, am I correct? Or can Nick hear me? I don't know. So if I am I guess while we are waiting to work this out, again, no, have raise your hand button or Q&A. Oh, okay, hold on, I had some new mess. Okay, oh, okay. You can see the chat, Fiona.
Yeah, and I can start.
Yeah, I was trying to figure things out. And if you would like to go ahead and answer them,
yeah,
be awesome. Okay.
Sounds good. Hannah, thank you for your question. So how did you know you wanted to pursue public health? I've always been really interested. I started being interested in infectious disease. I read a book when I was 12 about Ebola and got really interested at that point. But I think on a more functional level, I got very interested during college at PSU, where I was in my biology classes, I was in my political science classes, and I saw all of these intersections between these two, all the points where communication between the two fields would be really, really important. There's not enough communication of science to politicians, and there's not enough communications from politicians to scientists. And that's really the role of public health. In some ways, public health is a very broad field, but in many ways, it's being that middle point between the two and being able to help facilitate that communication. So in addition to my infectious disease interest, I was interested in that. Gary, yes, I agree. I think I would probably run into issues. This is taught at the university level to some extent. I think Felice does a very good job of teaching it. And I've certainly had it in my public health classes. I think at a lower level in high school or elementary school, I think it's very, very important to be taught. But you're right that there would be quite a lot of pushback, I think. But that's part of the issue. That's part of these systems that I was talking about, that they're set up to stay that way. They're designed so that they can't be changed. And I think we need to start to learn to work around that to change them. And maybe we don't teach this in classrooms while it's prohibited, unfortunately, or if it's prohibited in a certain classroom. But there are ways to educate outside of the classroom as well. And I think, starting to dismantle that has to come from somewhere. And forums like this are a good place to do that. Or just through other educational avenues.
Question on Q&A.
Okay, I will switch over. So this one says, I agree that a person's personal passion might intersect with their own interests and passions, but can you elaborate on how a person should start at a college level to work towards making their passions translate to practical options? So I think what I did, and maybe mine was just more conducive to an academic atmosphere, but having that science interest and that political science interest is doing as much as you can extracurricularly. I did Model UN, which Felice is also involved in, and I was involved in a lot with the World Health Organization within Model UN, which was great because that was an intersection that was right in school. It was extracurricular, but it was part of my academic life. And that was a very good practice way to get acquainted with this. And then quickly, that started when I was probably a freshman or a sophomore. And then by my junior year, I was at the real UN talking about that. So any opportunity you can have or find to start practicing is great. And if you have different passions, I mean, maybe it's biology and exercise or political science and something else, education. There are plenty of ways to volunteer. You have to be creative, but there are many ways to do it. But practice is my main answer.
Fiona, I have one, and I know that you are especially very engaged in New Hampshire and looking at COVID and what is the immediate and urgent need that that you notice. And these talks during the spring, we would like to focus and be optimistic and focus on renewal and what should be the first steps. And you notice the urgency there. And then also for our students and our community is any little tips that you see that they can engage. And by the way, just a reminder, either through chat, Q&A, raise your hand button, please feel free to join the conversation.
Yes, so for immediate need, so I think we are still clearly, COVID is very bad right now. We are operating as if it's not in many ways, but it's at one of the worst points in the history of the pandemic. As of a few days ago, it was at the worst point. So I think an immediate COVID need is making testing more available. I think there have been a lot of vaccination efforts. Frustratingly, not enough people are vaccinated. But I think we also really need to make testing more accessible. Even with great access to tests in an academic institution, it can still be 24, 48, 72 hours until you get a result, which is not helpful for slowing down a pandemic. You need much faster results. Rapid tests need to be more available. Then I think a longer term thing, which would be very helpful now, especially for kids who are in school, but also would be helpful long term, just living in a rural area where transportation is not great. Taking a lesson from COVID and realizing that we really need broadband internet access throughout the whole state, especially in northern New Hampshire. It's really bad, and it's a big equity issue to not be able to have kids go to school because internet is not available, or have people out of work because they can't work remotely because internet is not available. So I think that would help now, and it would help far beyond when the pandemic is at its peak points. And then small things people can do to help right now. Volunteering at vaccination clinics, I think, is great. Just being an advocate for vaccines. Vaccines are incredibly important and incredibly effective. And a lot of times people need a family member or a friend to push them over the edge and make it so they feel comfortable getting that vaccine if they were otherwise hesitant. So being as active as you can about knowing the facts about vaccines and being very communicative with the people in your life about how important they are, how effective they are, how safe they are. I think that's a really important thing and a really easy thing that we can all do.
I have one more. I know that outside your focus areas, you are still engaged in other health issues as well. And I think the unseen or unnoticed part of this pandemic is in other health crises developed, and we don't, I don't know, had the capacity, energy, or whatever, pay attention to those crises as well. And I know that you are paying attention to issues of addiction, overdose, and could you tell us what you are observing or what you are noticing, what is happening, what are the efforts? And I know you try, I don't know how you find the time and do, but can you tell us a little bit about that behind the COVID health crisis?
Yeah, I do need to preface this with I'm not doing anything actively right now. A lot of volunteer organizations are not allowing people to volunteer right now because of COVID. So I'm not doing anything active, but I have seen statistics that overdose deaths are getting much worse. I think there's probably some interplay with the mental health aspects of the pandemic as well there. I can't speak much more to it, but it's true that many other health issues are getting significantly worse during the pandemic because people aren't seeking care, or mental health issues, or addiction. It's getting much worse, and capacity is much lower. As of a few weeks ago, the state had no ICU beds left in several counties, especially the rural counties. So that means that you can't get treatment for COVID, you can't get treatment for a car accident if it's serious, you can't get treatment for a heart attack, for a stroke, etc. So this is not just impacting COVID patients. So the next one is, I've been struck with how different the vaccination statistics are in New Hampshire compared especially to Vermont. Both states seem similar in demographics, both with Republican governors, yet New Hampshire has, I think, the lowest percent vaccinations in New England, and Vermont has, I think, the highest in the entire US. Why would you say the two states are so different in this regard? I don't know. I think that's a very, very complicated ideological question that I don't think I have the information to answer, and I'm not sure anybody does at this point. I think it probably requires a lot of interviews, a lot of qualitative data to figure that out. But you're right that they are similar states, some pretty similar demographics. New Hampshire is much bigger, but other than that, they are similar. And my answer is I don't know, and I'm not sure that I have seen anything that would give any conclusive answer to that. Sorry.
You have another question in Q&A.
This is more of a broad question, but a lot of people see themselves as too small to create a big change. What was your thought process of taking on such big issues and finding potential solutions, especially issues that people have a lot of differing opinions about? I think that I think of it as an ethical imperative. I think I have, the education and the resources and the privilege to be able to do something, or hopefully do something about this, and the passion for both areas in my specific field that I'm pursuing, the specific intersection that I'd like to work at. So I guess I see it as, maybe it's intimidating and it's a lot of work, but I see it as I have been given a lot of privilege for various reasons, and it is my responsibility to use that, to use my education, use my privilege in other ways to try to help. And I think, that's probably most people's situation as well, is that, you may feel really small, but just being able to be on a Zoom call is already a lot of privilege, and understanding that we have that, and just getting over it and trying to make it whatever difference you can. And, it's okay if you can't achieve every single thing that you set out to do. But I think starting and trying and getting the ball rolling, and that's why I was emphasizing action, is it doesn't matter if you feel small or if your action feels small. Anything helps, and rebuilding these systems, it's completely important and like really the central piece that everybody is working on it, or a majority of people are working on it, because a few people doing really creative things is really not going to change that much in day-to-day life, probably. So it's important that we all do as much as we can, and also just realize that it's much bigger than each individual person, and look at it from a community perspective.
You have one in the chat, Fiona, switching back and forth.
I just said, so our response to COVID has become as much a political issue as a health issue. People compare mask wearing to MAGA hat wearing, and similar with vaccines. From a public health perspective, how does one approach this situation and break through the tribalism? Yeah, it's really hard. Clearly, everybody's struggling quite a bit with that. I think going back to what I was saying earlier, is it really doesn't work that well, as has been very, very clear, if it's coming from a point of authority. It works much better if it's family member or a friend, trying to have these conversations. I think that's a lot of where community change comes from, or other community leaders. I mean, church leaders, other religious leaders, etc., are also really effective. But coming from a political place or coming from someone who's viewed as elite is not necessarily helpful, and it needs to come from the community, I think. But clearly, neither have been incredibly effective so far. Do you think that state funding in New Hampshire, or lack thereof, is contributing to these inequities? Yes, I think we would be in much better shape if we reprioritized where we're spending money. And yeah, I think focusing, right now on healthcare obviously is important in an emergency situation, but I think really reinvesting in education, etc., could change this type of situation in the future. And unfortunately, we will have more pandemics. We will have other emergencies like this that will be politicized. And a big piece of combating that before they happen is making sure that we set up a system where people are educated, people know how to think through what is a fact, what is maybe not a fact, good resources, that type of thing. So I think if we prioritized more, that would be helpful.
I say it is about renewal and feeling better and hope, but I cannot also help that this is just, this might very well be the first of many, and I read about, oh, this is not even the worst one. And what are you seeing in our future? And
yeah, I mean, I would like to be positive here, but you're right. I think being realistic, this is likely the first of many pandemics for multiple reasons, one of which being climate change. As our planet gets warmer overall, species have larger ranges that they're able to inhabit, especially mosquitoes, that type of thing. And infectious disease, especially emerging infectious diseases, almost more than 75% of them spill over from animals into humans. So the more interface we have with animals, the worse it's going to get. So this is expanding cities. This is animals who can travel further because they have, it's warmer. There are a lot of areas where this is going to be a big issue, especially because populations are getting bigger. It's just a perfect storm of a lot of factors. However, as I was just saying, I think that we can prepare much better. We need to invest in science. Before COVID, pandemic funding had been slashed a lot. During COVID, surveillance funding, especially in China, was slashed, which is absolutely horrific in my opinion. For example, there are 400,000 coronavirus spillovers from animals, at least 400,000 spillovers from animals to humans every year. And we need surveillance. Clearly, most of those don't go anywhere, but we need to know that, and we need to be able to do that epidemiological thinking to know what's going on and to be able to predict and to make vaccines like a pan-coronavirus vaccine, pan-flu vaccine. Like, these aren't realities yet, and maybe they won't be, but we need to be able to think that way to be at all prepared for the next one. So I think our hope here is that we do have the ability to be more prepared, but it's a matter of funding, and it's a matter of people realizing that science does not need to be politicized. And if we don't do that, then we could easily be much worse off the next time. But I also do think we have an opportunity to be well prepared.
I guess it is like human nature a little bit. We do not want to think the long term, and we cannot envision that. Then we do not envision that, and then we do invest, and then our politics is shaped by long visions. Our politicians feel whatever they do right now, and they have to get the benefits or the results of it so quickly, so in the next election they can win. Investing into things, and especially science, is like you might not reap the benefits in years, so they feel like they cannot sell it. So I feel like we need to get out of that mentality, and long-term investment is necessary if we are going to end up managing to survive even the short term.
That's also electoral politics. You know, it's a 2-year, 4-year cycle, and that's as long as you can think ahead to get elected. So I mean that there needs to be a whole cultural shift, but it needs to happen to be better prepared for the next one. Fiona, what advice would you give to current PSU students who are passionate about change, about equity, about deconstructing these systems? What can they do while at PSU to grow towards contributing to these goals? I think leadership training is awesome. I think that is a huge piece of why I have been able to start working on this at this point. Some of that can happen while at PSU. I did Model UN. I think that's great. It does not matter what your major is. In understanding international relations, understanding how to look at an issue, develop arguments, it's all really important no matter what field you're in. So I would recommend something like that, especially Model UN is great, but you know, anything leadership along those lines. Student government's great as well, just practicing those skills. I also recommend programs like the New Leaders Council, which I did. You probably can't do that in college, but right out of college, yes. That it's amazing. Teaches you lots of skills necessary for thinking through. I think a lot of how I'm able to think through what I'm interested in, how they intersect, everything I just talked about is because I've gone through a lot of leadership trainings that are really focused on figuring out what's important to you and how to communicate that. And I think a lot of times leadership training is seen as, well, I don't want to be a politician. Why would I do that? And that's not what these are for. We need leaders all over the place. And leadership looks very different depending on the person. So I think there are some stereotypes around that deter people that shouldn't. So I would recommend that. Running Start is also great if you identify as a woman. Again, don't need to want to be a politician to do that. It's just very helpful in terms of goal setting and figuring out your long-term plans and how you fit into the larger picture. So yeah, I mean, I think just practicing as much as you can. I also think getting involved in politics. You can on a campaign if that's what you're interested in. There are a lot of campaigns that do not have anything to do with a specific candidate. Depending on political ideology, you can do one of those, and also start groups. If what you're interested in isn't there, start it. I think that's also something that is really important and is a good experience to be able to get something off the ground.
I'm sure we are passionate about something and be an advocate and then build on it. And I think this is all I see. Fiona, thank you so much for joining us. And I wish it were in person, but I am really hoping that things will get a little bit better and you will have a chance to come back to campus and talk to our students one more time, but this time in person. Thank you so much, and thank you so much everyone for joining us, and be safe. Have a good night. Bye. Okay.